put a smile on your face when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
Welcome back to the morning show on Tobago Updates Television. I am Adanna Combie, and we continue conversations this morning in studio with our guest. We're speaking with Dr. Paul Crooks, veterinarian, and we're talking about World Veterinarian Day, and we also have a very important topic. We're talking about impersonation of veterinarians. So we're going to have that conversation. Stay tuned because you want to hear what's happening. Good morning and welcome.
Good morning. Thank you for having me.
Of course, a pleasure. And of course, we just celebrated World Veterinarian Day on April 27th. So what was that like in the Tobago space?
Well, it was, for me, as current president of the Trinidad and Tobago Vet Association, it was all about the entire fraternity. And the theme this year was veterinarians are essential health workers. We recognize that within the Trinidad and Tobago space, we are already recognized as essential, given the COVID experience.
Right.
And well, of course, we know vets are essential for food security.
That's right.
And we do importations, exportations, and as time is going on, for example, we had a disaster risk management workshop in December where we recognize that there are gaps. There are persons who own pet animals who would die for their animals. No exaggeration. Where we've seen in videos coming out of places with severe flooding and so on, you see people swimming in flood waters to pull their dogs out of the water. Or you've even seen videos of rescuers going in to try to recover a horse. The emotional bond between a person and his pet, or whatever relationship they may have, that emotional bond is incredibly important. And in our policies regarding emergencies, that was not taken into account. So in a hurricane, people were instructed to leave their pets at home and come to the shelter themselves. But if people come to the shelter themselves without leaving their pets at home, they might as well die in some cases. So those persons may stay at home and choose to stay in a higher risk situation for
because
themselves
of that emotional connection.
That's right, because they refuse to abandon their animals. So this is something that we now recognize is also important. So if you consider that aspect, so aside from food security, that also makes vets essential. But furthermore, the breadth of the training that veterinarians have, I compare it to graduating high school. When you finish vet school, it sort of feels like you can do whatever you want. You've learned public health, which is also very largely linked to human health. And of course, I push the One Health idea that human health, animal health, and environment health are all interlinked, and we should work together across the different spheres. So medical doctors, human doctors, zoologists, biologists, etc., work together, even economists, because we know that there are persons out there who are, let's say, hunting wildlife, and that may be something they learn traditionally and so on, and you might have a conservationist standpoint, like even with the killing of the sharks, who says, you shouldn't do that, just outright ban it. But then we have to try to understand the mental and financial well-being of the person who is hunting the sharks. Why is he or she doing this? And we know that recently with the shark attack, it was unfortunate. There were reprisal killings, I suppose, which is not okay. And we try to encourage people to think that animals, even though we may consume meat, animals, basically all of the meat we consume have animals that are sentient. They are aware. They can feel pain. So you should be mindful of that in the way that you deal with them. Even the way that they are killed should try to minimize the suffering that they endure. So all of this, we know that vets are essential. Trinidad and Tobago, we had COVID come up. Vets were called to give vaccines as part of their breadth of training. Vets were co-opted when there were the big vaccine drives at the start of the COVID vaccination period. So we know vets are essential here. And what we did in Trinidad and Tobago, we had our general meeting, our first general meeting for the year. And vets were asked to post on social media and share the hashtag vets are essential and get it trending and show that we support the veterinary colleagues in other countries where they are not recognized as essential.
Right. So, I mean, I want to go back a little bit to where you spoke about the animals are sensory, meaning that they feel pain and they are aware of what is happening around them. And now we're talking of course, we use animal meat for, in our diets, for our meals. And so now we have to consider how we dispose of their life before we consume the meat from the animals. That's very interesting. That's very, very interesting. And now, sometimes, I mean, is it that we supposed to be vegan now and not eat meat? Of course not. That's not what you're saying, right? What you're saying is just be very mindful. So what is your recommendation in terms of, preparing an animal to slaughter for meat, for use of meat?
Well, it depends on the animal, really. But basically, you have to think, because these animals, you cannot use any chemical restraints. So basically, you can't sedate or anesthetize, which means that you have to find a way to kill the animal without the animal suffering. One of the best ways to do it, which might sound very strange to say, is something called a captive bolt pistol, which is a type of a gun with a sort of mushroom-shaped prod at the tip that is meant to shoot through the forehead and down and destroy the brainstem immediately, so that the animal no longer feels any suffering. And that's one of the best ways to do it. But other animals like fish, for example, typically they have the equivalent of drowning or suffocation when they come out of water, which is probably not the best way to die. I don't know what the best way is.
I'm thinking.
Reptile type animals, cold-blooded animals, you can actually freeze them, and that's considered humane because their body temperature drops according to the environmental temperature, and they enter a state of sort of hibernation, I guess. And as they freeze, as the temperature gets too low for them to survive, they are not conscious. So they are okay with that happening. But then you have to also consider other reasons you might not want to freeze an animal prior to processing for meat. Either way, it's a complex issue. But at the very least, while the animal is alive, that is why you should give it the best quality of life you can. And that's why there's been this growing push for like organic rearing and giving the animals the opportunity to behave as they normally would. I mean, they have a short life, let them enjoy it. And that's kind of the push now.
This conversation, I'm beginning to feel a little bit guilty this morning having this conversation. But very, very good information on some things that we should probably consider when we prepare our meats for consumption. I want to go now into the fraudulent behavior. You were talking about veterinarian fraud and impersonation, and it is alarming to me. I mean, fraud is a word we hear all the time. We know there is fraudulent behavior, but in terms of this type of practice, there are medical persons who act fraudulently and impersonate. I've seen so many documentaries and so many real life stories. But when we're talking about animals, I'm trying to figure out what is the benefit here in being and impersonating a veterinarian, and what kind of activities have been happening in our space, both Trinidad and Tobago, and specifically in the Tobago space.
Right. So the incentive is basically financial incentive. I want to say that basically is always what it boils down to. People want to make money and they find ways to make money. I was talking to you during the break. There are some gaps in the legislation, and not just in the veterinary field, also in the dental area, medical area, pharmacy area. There are gaps. The legislation addresses the actions of the registered persons. We have a veterinary surgeons registration board where every vet that is legally practicing has been registered. And the board is empowered to take action against vets. However, if you are not a vet, so there's malpractice and unethical behavior by persons who are not registered to practice, and there's nothing that can be done from the board.
Because they're not registered.
Because they are not registered.
So the board only takes action on registered vets.
Can only take action.
So if I graduate from veterinary school and I'm a vet,
yes,
but I'm not registered, and there's some measure of malpractice, then I'm safe.
The board cannot take action against you. Now, officially, if you impersonate a vet, the board can, or the ministry, through the police, can act to charge, because impersonating a vet is illegal. However, that is where we have to come down to, what does it mean to impersonate a vet? If you go by a client and the client assumes you are a vet, and the client says, hey, this is Dr. Crooks, come look, Dr. Crooks, he does give shots to all the dogs in the neighborhood, let him come and see your dog. So Dr. Crooks come in, you believe is Dr. Crooks. He never tells you he's Dr. Crooks. He never identifies himself as Dr. Crooks. So he didn't impersonate a vet, because your friends say he's a vet, you believe it, and he comes in to give shots. So it makes sense that he's a vet, but he never identified himself as a vet. So
but he administers the shots.
Right, but is administering a shot something that is exclusive to the realm of the veterinarian? And that is not captured in the law, because we have veterinary paraprofessionals, for example, persons who may have worked with a vet for 5 years, 10 years, the equivalent of a nurse sometimes, or we have people who assistants in the field, and these persons may have observed or even been asked by the vet to assist in certain ways, that they now take those skills and say, let me try and apply it outside. And they acquire medications, even in some cases stealing from the veterinarian. This has happened before, and sometimes even students may steal medication and go and administer medication or perform surgery on their own. And again, like, what's the level of supervision there? Yes, we know that a vet is supposed to supervise a student administering, but is a Zoom call equivalent to supervision? Is that good enough? If a veterinarian is absent from a clinic, and this has happened, is absent from a clinic, a student shows up, he's in his final year. The student shows up to the clinic, and the student is identified by the receptionist as a vet, never identifies himself as a vet, goes into the surgery room to try to correct a surgery that went wrong because a non-vet performed the surgery. I'm telling you, this is how complex the cases can get. A student goes in to perform or to correct a surgery, again, never identifies himself as a student. Is that person impersonating a veterinarian? If the vet says, pull up over the phone, says, pull up this medication and that medication and give it this 5 milliliters of that and 10 ml and hook it up on IV fluids and run it at this rate, is that person impersonating a vet? And that's where we get into the what does the law state? And unfortunately, the law doesn't really state anything in that regard. So it means that we're in a position where, how do we say what it is a vet is supposed to do? And then when we can define that, now where's the action? How can we take action against this person? And even the police don't know how to react. If you say, look, I know a man who's not a vet giving shots, they say, okay, well, what do you want us to do with that?
Right, and you know, that is scary, because when you think about it now in human medicine and human practice, I mean, that is very, 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 very cause for concern and very scary to think about. I mean, we're not supposed to take any living form for granted. And we're not supposed to think of ourselves higher than anyone. So if this is happening to animals, I'm equating it to happening to human beings. Because can you imagine walking into a practice and somebody saying, oh, look, Dr. So-and-so, when in fact, what Dr. So-and-so is really somebody who was, let's say, the office admin. But because he's been there for 20 years and he's seen the doctor doing all of these things, yeah, I can do this or I can do that. That's very scary. And, you know, I'm hoping that some sort of, something can be put in place. As you said, the law has to be amended, you know, has to be reconsidered again, and changes have to be put in place to regulate it. I would love to see how this rolls out and what adjustments they make and how they define the practice of a vet. Because, I mean, this is some scary, scary things that we're talking about. You mentioned earlier the relationships that people have with their pets, and so, you know, should something go awry when we have these impersonations, people can be sued. And if I'm not a real vet and I don't have any backing and I don't, how am I as the pet owner going to recoup anything from, this type of behavior? Interesting conversation coming here this morning. We're talking to Dr. Paul Crooks about, of course, impersonation. He's the president of the Veterinarian Association of Trinidad and Tobago, bringing some information here in terms of how do we prepare animals for meat, for consumption of meat. And of course, this is a very important matter of impersonation. We don't want to be in a position where we, as human beings, fall victim to a medical practitioner being impersonated and administering any type of medication or any type of procedure to us. So let us be aware. And if you see something, of course, say something.
Please do.
If you know, as you said, somebody would say in the neighborhood, this man give shots to all the dogs, let's take our dogs there. Let's not do that. Let's do our due diligence and all the research that we have to do. In closing, is there anything else you want to share with our viewers?
Yeah, if viewers are curious as to whether or not the person you believe is a vet is actually registered with the Veterinary Surgeon Registration Board, send us an email at TTVA, Trinidad and Tobago Vet Association 2008 at gmail.com. Send us TTVA 2008 at gmail.com. Send us the name, send us information, whatever information you have, and we can find out for you, certainly.
And is there, as you mentioned, that the registration, is it public that, let's say, for instance, I want to take my pets to a vet, I can look it up before to verify that this person is registered?
Sort of. So officially, when vets are registered, the names are published in the Gazette, which is our national newspaper, basically, of record whenever laws are assented and important regulatory work is done. However, the team responsible, even the Vet Surgeon Registration Board, is such a small team that to try to get an updated list has been very difficult. So you can email us and we'll confirm, but finding a registered list online is difficult. We're trying to work on that.
Got you. Ladies and gentlemen, we've been speaking with Dr. Paul Crooks, president of the Trinidad and Tobago Veterinarian Association. Remember, if you want to get some further information or you have information, you can email them at ttva2008 at gmail.com. Thank you so much for staying with us up until this point. We have to go for a short break before we continue conversations in studio with our guests. And as we go, of course, we invite you to share the live, share the live, share the live. We'll be right back. Thank you.
You're welcome.
Yeah.